As the chair of the British Medical Association, Dr. Chaand, Nagpaul, and Ashish's piece there, a real reminder that throughout COVID-19, the NHS has not only been heroic, the way that a lot of the staff have really worked so extraordinarily hard to save lives, but also so many of them have been victims as well.
Absolutely. And I think this birthday marks, of course, a recognition of NHS staff and care staff going above and beyond, but it also marks a somber note that we have lost so many lives from healthcare workers on the front line during the pandemic. About 61% of all of those who have died in terms of healthcare staff come from a BAME background, and 90% of doctors have come from a BAME background. So I think it also is about recognizing the immense value and contribution of our international workforce that is integral to the NHS functioning.
Has the NHS ever had a year like this year?
Not in living memory, certainly not since I've qualified as a doctor. This has been an unprecedented challenge to the NHS. I think there are many lessons to be learned on this birthday. We do need to make sure that in the coming year, the NHS is given the resources it needs in terms of beds, in terms of staff, in terms of facilities, because what we did in the pandemic is we dealt with the pandemic by putting a halt on the rest of care for patients without COVID. And they have also suffered something like 12,000 estimated excess deaths from non-COVID. We need to move in the coming year, not with the backdrop of what we had before the pandemic, and make sure that the NHS has the staff, it has the beds, it has the facilities, it has the infrastructure, and care, the care sector as well, having the capacity to provide care, because we know we're heading to a winter where the pandemic is likely to continue in a coexisting manner, and that's what this birthday should mark, a present to the NHS of providing it what it needs, but also a present for a recognition of equality, because what this pandemic has shown and what the NHS stands for, of course, is equal treatment for all. And what we've seen, of course, is that health has not been affecting different sectors of our population and healthcare staff in an equal way. And that needs to be a commitment as we move forward.
I think a lot of people's relationship with the NHS may have changed during the last few months and has shot up in the estimation of so many people. The Prime Minister, when he came out of hospital, talked about the NHS being powered by love. I mean, do you think these warm words and this lovely, warm, fluffy feeling that seems to be surrounding the NHS at the moment will actually be followed up with more money?
I think that it's really important that the government commits to its pronouncements. And we heard from the Chancellor that the NHS will get what it needs. Now, all I think we're asking for, and we've always asked for as the British Medical Association, is for the NHS to be given the resources that are taken for granted in other comparative countries. So we had something like a quarter of the intensive care beds as Germany when we started the pandemic, and we literally had to close down most of routine services in the NHS to create that capacity. We can't do that again in the future. We need to make sure we have the sort of facilities that other nations, as I said, take for granted, so that we can deal with a pandemic, but also at the same time make sure that the health of all patients is looked after as well. So that needs resources. That will require more money to ensure we have that infrastructure. And it's vital that this is, in a way, as I said, a commitment to the NHS on this 72nd anniversary.
Do you think the NHS will still be here in 72 years' time?
I really hope so, because it is an institution that has shown itself to be built on camaraderie, people working together. In fact, I'd go further, that it's part of the NHS's family is social care as well, and we've seen that. And it's been quite touching to see just how much people have, as I said, in fact, put their lives on the line to be providing a service with a commitment of doing good. And that national institution of values is vital. But in fact, what we, I think, as staff in the NHS and doctors feel let down by is when we aren't given the tools to be able to do our jobs as we would like to for patients. So it certainly should continue. It's a very cost-effective institution compared to other systems of healthcare delivery. But what it needs is to be given the resources and the tools and facilities to be able to do its job well.
Dr. Chaand Nagpaul, good to talk to you as always. Thank you very much for joining us on Sky.
Thank you.